Thanks for joining us today. Welcome to the Center for States video series on the essential functions for intervention testing, piloting, and staging. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Intervention Testing, Piloting, and Staging Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to plan for and execute the rollout of a new program or intervention. It does this by providing step-by-step guidance to conduct usability testing where needed, determine the need for piloting a new program or intervention, and guidance to complete it, and finally, guidance on planning for staging and scaling up implementation of the new program or intervention. Intervention testing, piloting, and staging is broken down into 3 parts and 10 essential functions or tasks, and it's important to remember that not all agencies will complete all of the tasks in the brief, depending on their circumstances. And while the steps are presented in a linear way, in practice, often the steps will overlap and be revisited as teams test, pilot, and stage. Part 1 is usability testing and includes creating a usability testing plan and then conducting usability testing, analyzing results, and making adjustments covered in modules 2 and 3 in this series. Part 2 is piloting and includes determining the approach and developing a plan, identifying and recruiting sites, conducting the pilot, and assessing results, reviewing progress, and then making adjustments covered in modules 4 through 7 in this series. And Part 3 is staging and scaling up, including developing and refining plans for staging the intervention and scaling up, identifying sites and sequencing, building capacity and scaling up, covered in modules 8 through 10 in this series, and then in this module, we will discuss the 4th and final essential function in staging and scaling up, reviewing progress and benchmarks. Let's get started. Routine monitoring and checking in with identified benchmarks or short-term outcomes is critical to scaling up processes. Reviewing progress and benchmarks helps teams identify what is working well with implementation and any areas that have not gone as planned or that have presented barriers for sites. Reviewing progress and benchmarks also helps teams determine if there has been fidelity to the intervention implementation. Identify any early indicators of success, trends in consistency, or notable differences in the feedback and information collected from sites. And guide adjustments and allocate resources strategically as implementation progresses. Reviewing data is an essential part of decision-making during implementation efforts, and it's important to remember that jurisdictions may not be able to measure everything and that they may need to make strategic choices about what measurements are a priority. Teams should aim to collect and review data related to progress against planned timeframes and milestones. Is the intervention being implemented in the timeframes planned? Are there any adjustments needed to the timeline to move forward? Is the intervention being implemented in the targeted number of cases? Implementation supports and development of capacity. Are the planned supports and capacity building helping as expected? Have all workers received the initial training and coaching? What about refreshers or updates? Delivery of the intervention as intended, for example, fidelity to the program model. Has a fidelity protocol been established? What tools or methods are being used to collect information about fidelity? Are they working? Consistency across sites. What evidence is there for consistency across sites? Are there similar patterns of the percentage of workers that have been trained or coached, or the percentage of cases that have been included across sites? Participant and stakeholder feedback. Are the established mechanisms for collecting, reviewing, and applying feedback working? How is this informing ongoing CQI and quality assurance processes? Short-term outcomes. Are any of the short-term outcomes being realized? And barriers and facilitators to success. What is hindering or helping to attain those short-term outcomes? How can the barriers be removed or the facilitators be capitalized on? Once teams apply early findings and make adjustments, they will want to make sure to establish stable approaches so they can move forward with summative evaluations of effectiveness. These topics will be addressed in more detail in Change in Implementation and Practice series on monitoring, evaluating, and applying findings. What helps teams to review progress and benchmarks? As a team, consider the following questions. How will teams monitor implementation and progress? Is the scale-up progressing according to schedule? Are milestones being met? Are core components being implemented as intended? Are practices consistent across sites? If not, are the reasons understood? What barriers and facilitators have been identified? Does the information collected suggest a need to make adjustments? Are there early indicators of success? Taking the time to review progress and benchmarks of the implementation effort comprehensively ensures that the intervention is being implemented with fidelity, that barriers are being addressed, and best practices are being shared across sites, and helps set the foundation for a successful change effort. It is important to note that as teams review progress and benchmarks, they should be continuously monitoring, evaluating the data, and applying findings to ongoing efforts. This topic and more detailed examples of this are discussed in the Change in Implementation and Practice series on monitoring, evaluating, and applying findings. Testing, piloting, and staging enables teams to make needed adjustments and allocate resources strategically before wide-scale implementation of an intervention. Testing, piloting, and staging should align with and prepare an agency for related fidelity assessment and evaluation. Before moving into monitoring, evaluating, or applying findings, the next phase in the change and implementation process, let's recap where teams should be thus far. A team with diverse expertise and representation is in place to guide the change and implementation process. The team has a clearly identified problem, an analysis of the root cause or causes of the problem, and have developed a theory of change that reflects a clear pathway from the problem to a desired long-term outcome. They have identified, adapted, or designed an appropriate intervention that is well-defined, a good fit, and is feasible within the agency's system. They have readiness assessment findings that include the areas of strength and capacity needs for the selected intervention or interventions, and have developed an implementation plan appropriate to the scope of the intervention that incorporates plans to build needed capacities. And the team has conducted usability testing on key protocols and processes, have conducted pilot testing when feasible. They have used feedback and findings to adjust and make plans to stage and scale up the intervention on a larger scale, and then reviewed early progress and benchmarks throughout. Teams can refer back to the testing, piloting, and staging brief for more detailed information on milestones specific for testing, piloting, and staging interventions. Taking the time to ensure that these key milestones are in place as teams prepare to move on into ongoing monitoring, evaluating, and applying findings will increase the likelihood of successful implementation efforts and sustainability of the intervention. Let's take a moment to check in on what you've learned about building capacity and scaling up. Why do teams review progress and benchmarks? To identify what is working and not working, determine fidelity to the implementation plan, and identify successes and trends across sites. How do teams review progress and benchmarks? By collecting and reviewing data and feedback from sites, and making any improvements or adjustments needed to stabilize the intervention. What can help teams review progress and benchmarks? Discussing as a team how implementation is going and the milestones being met, reviewing fidelity and consistency among sites, and identifying and sharing barriers and successes. Now take this a step further by reviewing the reflection questions for review progress and benchmarks in your intervention testing, piloting, and staging workbook to connect what you've learned to your own experience. As a recap, the three major sections and 10 essential functions in this video series on intervention testing, piloting, and staging include Part 1, usability testing, including creating a usability testing plan, and then conducting usability testing, analyzing results, and making adjustments. Part 2 is piloting and includes determining an approach and developing a plan, identifying and recruiting sites, conducting the pilot, and assessing results, reviewing progress, and then making adjustments. And Part 3 is staging and scaling up, including developing or refining plans for staging the intervention and scaling up, identifying sites and sequencing, building capacity and scaling up, and then reviewing progress and benchmarks. Feel free to go back and rewatch any of the videos in this series to refresh your memory. Remember to use the Intervention Testing, Piloting, and Staging workbook to reflect on your learning, record any outstanding questions, and think through your next steps. Join us for the other videos in this series to learn more about the essential steps for each part of the change and implementation process.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.